Batman. How are you doing?
I'm great. I thought I would just stop by to talk a little bit about Narcan because some of the students really didn't understand the concept.
Great. Come on over to the blackboard. Let's start by reviewing a little physiology. Remember that Narcan is an opioid antagonist. What that means is we need to first think about the opioid agonist. Opioids like morphine or heroin hit those mu receptor sites. Remember, the mu receptor sites are responsible for analgesia, and that's why we use it for pain control. But they have the side effect of respiratory depression, which is something that we worry about and can cause someone to stop breathing. The other thing is that those mu receptors also are responsible for euphoria. Now, when you're in a lot of pain, it's really nice to have analgesia and euphoria, but that euphoria is responsible for people wanting to keep coming back for more and more opioids, and that's where we get into trouble with opioid addictions. So in a nutshell, how opioids work with receptor sites are that an opioid comes around, has an affinity for that receptor site. In this case, it's the mu receptor sites. It settles into that receptor site and it fully activates the receptor site so that you have respiratory depression, analgesia, and euphoria. Now, when Narcan comes along, remember Narcan is our antagonist. Narcan has a stronger affinity for that mu receptor site. So it comes along and it displaces that opioid. In the case of opioid overdose, that's exactly what we want. We want to displace that opioid so that the person will resume breathing.
But what's that got to do with librarians?
Here, let me show you. First, let's imagine a library. Next, let's imagine Zach, our librarian. One day at work in the public library, Zach has an experience that unfortunately is not that uncommon in public libraries these days. As Zach is making rounds in the library, he discovers someone lying unresponsive in the floor. He tries unsuccessfully to arouse them. "Wake up! Wake up! Help! Someone call 911! This person's not breathing!" Luckily for our patient, Zach had recently attended a training on the use of Narcan. It seemed to him that this patient most likely had experienced an opioid overdose, and he retrieved his Narcan and administered it to our patient. Typically, that opioid antagonist will displace the opioid from the receptor site and the patient will resume breathing very quickly. Now, the thing to keep in mind is the Narcan has a shorter half-life than the opioid. So you have to be aware that the person can, after about 30 minutes, relapse back into respiratory depression. So you need to stay with the patient. This patient's going to need transport to a hospital, and you may need to administer a second dose of Narcan.
So besides librarians, who else should APRNs give prescriptions for Narcan to?
Great question, Batman. I'm really glad you asked. The APRN can write a prescription for Narcan for a person who's on chronic opioid treatment for pain. You can also write a prescription for Narcan to the family members of a person who are either being treated with opioid medications or who are addicted to opioid medications. This way, they have it on hand in case of inadvertent overdose. We can write prescriptions for Narcan to community service workers. This includes law enforcement, emergency personnel, or any helpers in the community, including librarians.
So would insurance cover the cost of the Narcan for community helpers?
Probably not, Batman. You know how insurance companies are. But check in with your local health department. Many have programs where they will give it away to community helpers. Keep in mind that Narcan comes in two different forms, nasal spray and injectable. Most lay people are more comfortable using the nasal spray. However, you do have to keep in mind that the nasal spray can't stay out in your car under extreme variations of heat and cold. It has to be brought in. One frequently asked question is, what happens if you give Narcan and the person is really not in opioid overdose? What if they're having a heart attack or a stroke or low blood sugar? In the event of giving Narcan to a patient who really hasn't had an opioid overdose, you're not actually going to hurt them with the Narcan. Think about that mechanism of action for the Narcan displacing the opioid on the receptor site. That said, the Narcan is not going to help any of those other conditions, so be sure that you activate the EMS and get help as soon as possible. And my last parting shot is that as an APRN, you play a critical role in prescribing these types of medications to people who are on chronic opioid treatment, family members of addicted individuals, and community action workers. Many hands make light the load, so let's all work together to take care of this opioid epidemic.